Okay, G-Star. I'm writing to update you regarding James, who is ready to be discharged back into your care after a successful recovery from his respiratory symptoms. Okay, fine, no problem. Well written. You can write this way, no problem. When admitted, James presented with the complaints of severe dyspnea, cough, hypoxia, obsession, and facial pain. His examination revealed erythematous orphings, breathing rate of 30. Okay, see, 30 breaths per minute. And what you think breathing rate is? Breathing rate is actually this, right? So you can just write breathing 30 breaths per minute, or you can just write increased rate. Everything would be fine. Okay, the problem is that you people try to be very specific, okay, and this way you actually, these five small words, they will not count it. Okay, so increased breathing rate will take it, or breathing rate of 30 will take it. Okay, along with that, he has sonorous V's and bibasilar fractals. Therefore, supplemented oxygen and ampicillin were okay, because you're talking about two, were prescribed. Okay, in addition, I would have written in a better way, like you can, therefore, supplemental, he was started, or he has started on supplemental oxygen and ampicillin was prescribed. Okay, that would have been much better. In addition, it's chest X-ray. And the other thing, I hope you are noticing this has and was thing. Again, you guys are making this mistake. Please don't do that. Okay, this is really a silly mistake. I've been crying over these things over and over again. Okay, when you're starting the visit, if you want to write it in the past, I have no problem with it. You can write it in the past. If you want to write it in the present, you can definitely write in the present, but write one sentence, one tense in the paragraph. Okay, that would be a better. I'm not saying this is a hard, fast rule or thumb print rule something, but this will not look good, because it is not possible that sometime patient is in present and then you are talking about that he was past. Like there could be two possibilities: either the patient is standing in front of you, or either he's not standing in front of you. Okay, if he's standing in front of you, write it in the present. Just giving you a lame example so that you can understand. And if it is not there, then it is past, simple. Okay, so the previous visits, you can write them in the past. Present visit, write it in the present tense would be better. But if you want to write in the past, then don't do this present, past, present. But what I call this is smoothie. When you are hungry, so what you do, and you have nothing to, what you do, whatever is in there in the fridge, you put milk in it and you create a smoothie. If it is good, if it's good. If not, then you are already hungry and now you are in a worse position. Okay, so don't do that, please. Don't create a mixture. In addition, this chest X-ray revealed pleural effusion, pneumonia, and CT scan revealed paranasal sinusitis, hence azithromycin. Now, this thing was the next, okay, after the next thing, okay. But you have merged it, that is completely fine, no problem. James's condition has improved. However, there is increased likelihood of lung infection. For that reason, he has been asked for homeschooling and hospital visits. This letter you have now, this is what I call as overly concise letter. There was a lot of information, and what you have done, you have skipped all things. This is also a problem. If you'll make over concise, still this is a problem. If you'll not concise, that is also a problem. So stay in between, please. Okay, for airway clearance technique, exercise, healthy diet, and double lung transplant, James's family history is suggestive of lung cancer and rhinitis. His current medication includes phenytoin, Panadol, Pulmozyme, and Creon. In view of the above, I would appreciate if you review James's, okay, for further assessment. If you're Now this is over concise letter, Dr. Kajal. I hope you're getting my point. What you could have done, this ampicillin thing, it is fine till here. The next from in addition is chest x-ray. This could have been made a new paragraph because this is actually a separate paragraph. Then there was something after that. See, there is a discharge plan, right? So you have to mention James has shown this, and then his discharge plan includes this, and then you can whatever is this increased likelihood of lung infection. This is advised. This is a discussion. So you have to write a discussion regarding increased likelihood of lung infection, okay, and decrease school time and increase hospital visits have been made with James, or you can write with his parents, okay. And okay, this was a discussion and they have mentioned it that this is a discussion, okay. So you can definitely write in that, no problem. Okay, but there's no need to make things overly, you have skipped a lot of information, and that is the reason it is now. Okay, overall it is fine. Some of the grammatical mistakes are there that I mentioned, but everything is okay. Okay, so but quite small letter. We have to focus on 180 words. If the letter is actually small, the case notes are small, then it's fine. But if not, then we have to mention. We have to write important information.